one of the important table I have, yes, this is what is the table I have already have taken a photograph from the from my notes. So what exactly can be a differential diagnosis of the chest pain, I can say. What exactly can be a differential diagnosis of the chest pain? So as I talked about, when we talk about common causes, like for example, may not be cardiac only. Cardiac efficacy is only one fifth of the differential diagnosis. Cardiac causes are only one fifth of the differential. In cardiac also, there are a lot of other reasons because it is not only the heart. It can be vascular problems. I won't go into the rarer causes. I will go to the simpler causes. But for you to understand, it can be a vascular condition like coronary syndromes, stable angina, aortic dissection. You may also take the screenshot. It can also be the valvular problem presenting like a chest pain, or it can also be the pericardial problem, pericarditis, myocarditis, cardiomyopathy, etc. Chest pain can also be lungs related, like pleura. It can be pneumothorax, it can be pleuritis, it can be pulmonary embolisms. It can be related to what? Pneumonia, tuberculosis. Tuberculosis is not going to give rise to chest pain, acute chest pain, but the cavity ruptures, it can result into an acute chest pain. So it can also be a known case of tuberculosis, cavitatory tuberculosis, the patient complaining about acute chest pain and breathlessness. It can be a pneumothorax, cavity of the tuberculosis rupturing into the pleura. Or it can also be the diaphragmatic hernia presenting like a chest pain. Not only that, chest pain can also be because of what? GI problems. Like for example, it can be biliary colics, cholecystitis, choledocholitis. It can be also esophageal disorders, like for example, esophagitis. It's a very interesting condition called as DES, diffuse esophageal spasms, nutcracker's esophagus, chalasia cardia, GERD. Esophageal impaction of the foreign body can also present like what? Chest pain. It can also be the peptic ulcer in the other. Not only that, if the young patient is presenting with a chest pain, it can also be the orthopedic related or maybe musculoskeletal related. Like for example, it can be costochondritis, arthritis, costochondral junction ka. It can be rheumatic disease, osteoarthritis of the costochondral junctions. It can also be the bone related. Like lot of times, because in case of old age, if the patient already has got some psychiatric disorders, psychological disorders, so when the patient is in a fear, when the patient is in anxiety, lot of patient also relate it, or I can say explain it like a chest pain. Like for example, it can be panic disorder. Oh, they will not say I have a panic attack, for example. They will say मेरे को breathlessness हो रहा है, मेरे को chest pain हो रहा है. Anxiety disorders, somatoform disorders, cocaine abuse producing spasms of the coronary arteries. Or it can also be local skin condition, neurogenic, like for example herpes zoster and maybe some of the other prolapse intervertebral disc, etc. So if you can see it together, अगर देखा जाए तो there are about 30 to 40 causes of the chest pain. It is not always the cardiac problem, and because of that, I thought I can take this because most of the time